What I've learned from viewing my classmates' articles and videos is that many countries offer a more expedited process and recoveries may be more easily attainable. However, one recurring theme that I saw with many other countries use government organizations to decide a patient's claim. I think it was New Zealand with the no-fault system that set up what was referred to as health court. And I assume that these panels consist of health experts, and I would be concerned that they may have a bias toward the physician or be trying to protect the physicians. The textbook mentioned how our courts, for a long time, it had a high deference to physicians regarding the standard of care. And I fear that such a panel of health experts would revert us back to this deference and not hold healthcare providers accountable for malpractice. I personally rather have a jury as a buffer between this deference to the doctor and the government when my case is being decided. Although it may be a longer and more laborious process, I feel it is the most democratic, if you will, approach to handling medical malpractice. Also, the jury can choose a path in which these trials are decided. And since there are a wider representation of patients rather than a panel that would represent the career healthcare experts, I think that would be more in the interest of our patients. And I would just ask, is a panel just another modern way of protecting the physicians? The article I chose had an interesting perspective because it was written by a British law student who came to America and interned doing some med mal work. And I also chose this because it compares the US and the UK, and we adopted the British system and based on British common law. The article explains that the UK case law does some line drawing to prevent doctors from operating and practicing without fear in the repercussions. And it's also to prevent the floodgates from opening. And the article said that the UK did this to prevent what they saw going on in America with the huge amounts of litigation for medical malpractice. And the standard of care in the UK is whether a doc reaches a standard of responsible body of a medical opinion. And I think that's kind of a easy way, it lets them off the hook easily. And as the article explains that it's harder to prove breach and causation, which I don't think is in the best interest of the patient because it's cutting off their accessibility to the courts. And the U.S. standard is whether doctors acted like other doctors do under these circumstances. I think it just holds them more accountable and to a higher standard. And concerning the Facing Our Mistakes article, obviously this was a horrible mistake and the doctor felt terrible about it. But I believe this physician failed to follow the diligent steps that are required to see if the fetus was alive before performing the D&C. And I found it ironic that the doctor started near the end of the article saying that technology has caused them to have to live up to a higher standard. But in this case, it was his lack of using technology that was the negligent act. Even though he was at a rural clinic, the locality rule is outdated and he should have ordered the ultrasound. Given all the circumstances, such as the patient's uterus becoming bigger and the lack of a miscarriage, and he had said that the uterus become bigger just within 2 days, and you think he would have exhausted all the means of discovering whether the fetus was viable, and even if that meant the patient traveling to another hospital, he should have had the ultrasound ordered and it should have been performed. Thank you.